Everyone is waiting for the heart attack to make its grand announcement. Then they run to the doctor. You have missed the bus. I see all the scientists, all the smart people, they have total knowledge about the surface of the moon, but if you ask them how is your liver, they don't know.
The sudden heart attacks which are happening and of young people.
Most people do not know that how fit they feel has nothing to do with how fit they are, and that leads to silent heart attack. People did develop heart attack before the vaccine also.
Yeah.
So you can't just put it across vaccine.
One part of your life I want to ask.
Birla at that time, and we treated her. I believe that India will become the first country in the world to dissociate healthcare from wealth. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy.
PhD, MPhil किसी भी विषय में डिप्लोमा के अनेक अवसर है RKDF यूनिवर्सिटी में एडमिशंस ओपन।
Most people do not know that how fit they feel has nothing to do with how fit they are. More than 50% of the patients with the heart disease, they have no symptoms. It's called silent ischemia, and that leads to silent heart attack. It is simple. If the same person had few cardiac tests, like a CT angio, 10 years earlier, that heart attack, so-called sudden heart attack, could have been anticipated or prevented. Develop heart attack before the vaccine also.
Yeah.
And also there is no doubt the incidence of heart attack is definitely a lot more prominent. Whether it's increased or decreased, I don't know. But it is happening, it's common. Yeah, it is common. Pollution has a massive impact on the human body. I don't know the extent, but I just want to give you one example. My son is a heart surgeon. He went to Japan for his fellowship in aortic and thoraco-abdominal aorta surgery.
Okay.
So, first thing he did was, when he looked at the first patient, 80-year-old man with the chest open, with his lung, he was describing, he called me with the excitement, he said, "Dad, this 80-year-old man's lung looks exactly like how a baby's lung is." Whereas in India, when you open the chest and look at the lung, it is studded with most of the time it is a tobacco or other particles. It's all studded with black spots everywhere. No, in adults. Adults, it is studded. Babies in India, it looks pink. But when they are 30, 40, when you open the chest, the lung looks awful. Whereas in Japan, it looks like a baby's lung. Definitely, the incidence of women in developing a coronary artery disease is significantly less till they reach the age of 40-45. The hormone of women prevent them from developing the heart disease. For the nature, women are more important than the men, as long as they are productive life. So the nature protects the women. Yoga is the best gift given by India to the world. I strongly believe that everyone, young and old, must practice yoga.